So I'm Dr. Patrick Dawson, OBGYN with Northern New Mexico Women's Health Center. And I'm talking today about the genetic testing that we're offering in our office. And we have, all of our tests are new to our office, so that we're just bringing them in. And I'm pretty sure that for a couple of them, we're the only general OBGYN office in the state that's doing them right now. So it's kind of cool that we can offer that to our patients. The first one, and perhaps the most relevant to our discussion today, is Myriad's MyRisk. Myriad, we all may know, did the BRCA testing. They were the first ones who offered BRCA testing for women with history of breast cancers, especially breast cancers in their families, to identify if they were carriers for the BRCA1 or BRCA2 genes. And then it kind of expanded their genetic testing to a whole family of different cancer genes. So the different genes, and I have pamphlets for anybody who's interested, but some of the different cancer families, they of course still do breast cancers, ovarian cancer, which leads into BRCA testing, as well as some other genes, gastric cancers, colorectal cancers, pancreatic cancers, melanomas, prostate, and endometrial cancers. And in those 8 different types of cancers, some genes overlap. So, for example, BRCA. If you test positive for BRCA, you're not only at increased risk for breast cancer, but increased risk for ovarian cancer. This testing is really important for women who have family histories of breast cancer, particularly if anyone with cancer was tested positive for one of the breast cancer genes, or whatever relevant cancer genes that for the relevant cancer that they have. So we call that the index patient, a person with cancer. And if we know that the index patient tests positive for one particular type of cancer, we really, it would change the type of screening, the type of testing that a woman may have to undergo in her lifetime. But if she tests negative, then her likelihood of developing cancer may actually not be as increased as if just because her family member had it. So just because they had that gene that tested positive. So what Myriad does is they, particularly if you have a family history of breast or ovarian or colorectal cancers, right now those are the 3 types of cancers that are most easily put through insurance companies in order to provide genetic testing, because the data is just best for those 3 cancers. If you have one type of those cancers, then, or multiple people in your family, we can offer this testing to you either through the Colaris testing, which is the colon cancer testing, or BRCA testing. And whichever way they do it, they run the whole panel. So it's kind of like when we do a CBC, and we get lots of other information that we may or may not need, but we really need a few pieces of it, and the rest just comes along with it. Same thing here. If we're doing the BRCA testing, we get the Colaris testing with it. And if you have colon cancer in your family, you're kind of getting the BRCA and the other genes all come along for the ride, because it's no more expensive to run the test for multiple genes than it is to do just one gene. So they're just doing one type of test and they're running everybody on that same test. So the ideal patient to test for is if one person in your family actually has cancer. Obviously, that is the person who should be tested. And if that person tests negative, it may save the whole rest of the family from having to be tested. They may still want to be tested, but that person's cancer may be totally unrelated to their genetics, or maybe related to their genetics, but just nothing that we can test for at this time. So it might be something that we can discover that gene 10 years from now, and then it makes sense to test them at that point. But at this time, if we have someone with cancer, that's the obvious answer. But as is true for cancer, not everybody with a family history of cancer has all of those people with cancer that are still with us today. And so we can test if the patients with the familial history, we can test them too. Whether their family members are not available to test, or they're unwilling to test, or for those reasons, we can still offer them that testing. So anyway, so that's the MyRisk. And I have pamphlets that will talk a little more in detail about what type of genes they're actually testing for, specifically which genes they're looking at. It'll talk to you about what type of results you get, and I'll go over that briefly too. If your test is positive, they don't just say you're positive for this gene. They'll tell you, based on your family history that we reported when we filled out the form to send to the testing company, they'll tell you not only that which genes you're positive for, but what that means, what type of testing you should have done. So should you have annual mammogram, or should you have more evaluation than that? Or when should you start? If you're 25 years old, we wouldn't normally start mammography. But maybe there is some testing that you should be starting to have done based on your specific genetic profile, okay? And some people have not just one gene, but multiple genes, and so it's a whole series of tests. The more common results is actually women with family histories, even strong family histories, is that they themselves do not test positive for that gene, which can be a real relief. And what the results for that will say, you don't actually test positive for these cancers that we tested for, or these genetic predispositions that we tested for. In that case, it doesn't mean you're not at increased risk for cancer versus the general population, but maybe you're not. Or maybe there's a new gene that we haven't discovered yet that you have and your family members have, but we haven't found that out yet. So in that case, this is what we should do for your testing. So it's not just a blood test result, it actually gives you a multiple page synopsis of what that means for you. What kind of results, or what kind of testing we should do, or screening in the future for you. Okay, so that's the MyRisk. The next, we also have 3 different pregnancy-related genetic tests that we offer in our office. So the first test is called the Horizon Screen, and this is a carrier test for women who are considering pregnancy. It can be done during pregnancy, but it's really designed before we choose to become pregnant. And it's relevant to screen any patient. The most common carrier testing that we used to do was cystic fibrosis testing. Cystic fibrosis is present in 1 in 24 Caucasian people with no Jewish history. It's more common in Ashkenazi Jewish history patients. Based on your genetic background, different populations of people have different risks, but it's present in at least 1 in 100 in every population throughout the world. So the lowest risk is greater than 1 in 100, as far as I'm aware. So that everyone is at potential risk for being a carrier for cystic fibrosis, for example. If you are a carrier for cystic fibrosis and your partner, or the person you're choosing to try to make a baby with, is also a carrier, that might actually increase your risk for having a baby that's affected. And having a child with cystic fibrosis is not an insignificant kind of a thing. So if your risk was 1 in 100 and your partner's risk was 1 in 100, the likelihood of both of you actually being positive and then having a baby that's affected is really remote, and maybe you're not so worried. But if your risk is 1 in 4 and your partner's risk is 1 in 4, that's kind of scary. 1 in 16 chance that your baby's going to have cystic fibrosis, and perhaps there's things we can do to prevent that genetic match from happening. And that's just one example. So the Horizon Screen will test for a myriad of genetic tests, and I have only one pamphlet, but we can certainly get more copies if anybody is interested. Our office is on the first floor, we can get copies to you. The standard test that the Horizon will screen for is Bloom syndrome, Canavan disease, cystic fibrosis, familial dysautonomia, Fanconi anemia, Federal X, Gaucher's disease, glycogen storage disease, and there's Tay-Sachs disease, a whole myriad. But if you have Ashkenazi Jewish history, there's a whole extended panels for people with that background, because they're at much higher risk for unique things that other populations really aren't at a higher likelihood of being a carrier for. So it wouldn't make as much sense to screen them, but for people with specific familial histories of certain things, and that's not just if you know your family history is present, has that in your family, any of these diseases, we can test you for it. You don't have to have a specific familial background in order to be tested. But if you just have a familial background and no people in your family, we can still test you. Generally, these tests, all the tests I'm talking about today, are generally covered by insurance. Usually the MyRisk, it's covered for women who are who have multiple family members that have the disease, have the cancers. For the Horizon, it's generally covered for everybody because anybody can be a carrier for cystic fibrosis, and along with cystic fibrosis, they're doing a whole bunch of other tests. The next one that I'll talk to us all about is the panorama screen. The panorama screen is a while you're pregnant kind of a test. And this is actually, Dr. Varnack, my partner, and I are very proud to offer this to our patients. This is a test that can be done as early as 9 weeks of pregnancy, and it can tell us a lot about the chromosomes of our babies. It'll obviously screen for Down syndrome, so we can rule out with virtual certainty. It's still listed as just a screening test, but it's the data really is much better than just the routine screens that we were doing before. What this test is like the other test, is a simple blood draw from the patient. And for this pregnancy test, how we get the DNA based on the mom's blood for her baby is that they take the free DNA that's floating in mom's bloodstream. And some of that is mom's blood, or mom's DNA, and some of that is actually the baby DNA. And so by spinning it down and getting the part of the DNA that belongs just to the baby, we can look at the baby's genetics. And so it's pretty awesome that that kind of technology is available now, and I can only imagine what the next 10 years is going to bring us. But as early as 9 weeks, the fraction of DNA that's in mom's blood, that's actually fetal DNA or baby DNA, is high enough that we can actually get pretty certain results. We try to wait till 10 weeks just to increase the likelihood of getting enough DNA, but as early as 9 weeks, it'll screen for the chromosome. So it's not a carrier type. So carrier type is where the old way of growing cells, you had to have live cells, not just DNA fragments, and then that you counted the number of DNA products. This is actually a different type of analysis that takes a look at the little pieces of free-floating DNA. So they don't need much. They don't need any live cells, which we shouldn't have in mom's circulating blood. But by getting that free-floating DNA, they can look to screen for Down syndrome, trisomy 18, trisomy 13, triploidy, which is extra chromosomes for everything. It'll look at the different sex chromosomes, so Turner syndrome, which is monosomy X, Klinefelter's, Jacob syndrome, and triple X. They'll also look at the different microdeletions are available. So if for certain families we have, there are microdeletions that we know that are in that family. And we can actually screen if this pregnancy is affected by that microdeletion, whether or not this baby actually has that. As early as 9 weeks of pregnancy, I mean, it's pretty amazing. And then the most popular test that this will do is it'll tell us the gender of the baby. Not all families like to know that information, but a whole lot do. And to be able to have that information so early, it just kind of, back in the day it was waiting for the birthday. And then it was waiting for that ultrasound. And now it's waiting for basically as soon as you find out you're pregnant, we can tell you the gender, and you can be excited very early. Or disappointed. We have a few of those too. So that's the panorama screen. We do also have, and I didn't bring the sample, but we also have the ability to test for women who have pregnancy loss. Pregnancy loss, it can be very emotionally damaging to a family for really important reasons. And it also women are concerned that, what did I do wrong? I've heard, I ate that spicy chili with my breakfast the other day. Is that what caused this to happen? We were moving and I lifted that heavy box. I had all these things. We as doctors know that most pregnancy losses, especially in the first trimester, have to do with the baby's genetics. The chromosomes didn't all work out correctly. The DNA isn't correct. It's not going to have the potential to make a baby that's going to survive and be born someday. But we used to not be able to test and tell the parents with certainty that that's what happened to their pregnancy. Now we can. So we can take that pregnancy loss tissue and actually test the DNA even when that pregnancy loss has happened remote from when we have the tissue sample. So it doesn't have to be, back in the day, again, to do the karyotype testing, we had to have live cells. And so if the baby passed before we had the ability to test, we weren't able to give that family any answers. Now we can. And even though it's a sadder part of the testing that we're able to offer, it can be very reassuring to a family that it's not something they did. It's not something that, it's not that spicy chili that they had. I hear that a lot in New Mexico. And it's not. The spicy chili doesn't cause a miscarriage. And on the other side of that is, for families who've had multiple pregnancy losses for the same type of problem, we find out that in that family there is, either in the mom and the dad, or the dad, there is an actual genetic predisposition to miscarriage, that they're not going to be able to. And instead of waiting 20 years of trying to have a successful pregnancy and trying to expand their family that way, they can choose alternative reproductive technologies to try to expand their families, or choose adoption, for example, that this route won't work, it won't be successful. And that would be information they might not otherwise have known. We would say, I'm sorry this happened, you can try it again. Maybe not so cold-hearted, but that was the old advice. We didn't know if it would happen again or when it happened again. Now we have a much better idea in some families, so we can help them out that way. Does anybody have any questions about any of the tests we talked about today?
Yeah, the cost of the panorama one, is that usually covered?
So the panorama is really interesting, and we're really proud of this test. So depending on which test the woman wants to have done, including the extended microdeletion panels, it can cost anywhere from $2,500 to over $5,000. So having insurance coverage is really important. Most of the time, unless the family has been affected by miscarriage or some of these other problems, it's not always covered by insurance. However, because it's such a valuable test and because they really want us to be able to offer to all of our patients, the company that provides this for us, the Natera, they are willing to provide this test for our patients only at $25 cost, regardless of insurance coverage. So as long as they have insurance, regardless of whether the insurance covers it or not. So even when it's not covered,
Is that including Medicaid?
it includes everybody. You have to
Medicaid
have.
doesn't even pay.
No, I
Right.
figured it didn't pay, but
No, but
yeah.
the patients don't have to pay. They don't.
Oh, really?
Yeah, so they'll do it for 25, for our, I mean, this is, we had one recently, it was $5,400
Wow.
was the patient's bill. And their out-of-pocket cost, $25. Like that, and they were doing deals for, $125, $145 for other offices. For our office, they're $25. And I don't know that they have that deal with anybody else. But it's something that we're trying to offer for routine testing. The reason why this is so valuable, and the reason why I think that this is going to replace, and insurance will start paying for this, right now, the alternative to this type of testing is the serum screens. So you can have chorionic villus sampling or amniocentesis, both of which have risk of loss of the pregnancy. So you can have what is a healthy pregnancy that is not affected by any problems, but you do the test and you can lose the pregnancy as a result of the test. That's.
On that test also is costs.
Oh, and that's
Yeah.
terribly expensive as
Yeah.
well. And that is the old way, the karyotype testing. We can do the serum testing, which is looking at different hormones in mom, and depending on when in pregnancy we do it, or which hormones we're testing for. But we look at different hormones. Those hormones in babies that are affected by Down syndrome are much more likely to be varied than in babies that are not affected, which are much closer to an average result. So the further away from the average the result is, the more likely it is that that pregnancy is affected by these various conditions, most importantly Down syndrome, or most commonly Down syndrome. So we used to be able to tell women, well, you had a high risk of Down syndrome. And that high risk could be as low as 1 in 275. So that means that for every 275 women that had that result, only 1 of them actually was carrying a baby with Down syndrome. But 275 of them were scared, were nervous, they were feeling they thought their pregnancy was affected. This is my brother, just 2 months ago, maybe a month ago. His wife is pregnant, and they had the old testing, and they came back positive. She told everybody in the family that she was carrying a baby with Down syndrome. Get over it, family, because I'm keeping the baby, and you better be accepting of my baby. And I said, well, wait. Let's pull back. Of course we're going to be accepting. But how do we know that this baby actually has Down syndrome? Did you have one of these types of tests that is able to tell us? Did you have an amnio or a chorionic villus sampling, which is able to say for sure, yes, this baby has this problem? Or did you have a serum screen? And if you had the serum screen, did your risk come back to 1 in 275, such that you have 1 in 200, or 274 out of 275 chance that your baby does not have Down syndrome? Turns out her baby does not have Down syndrome. But she went for several weeks, certain she had a baby.
What's the false positive rate?
It's like, no.
So this does give us a report of what your risk is, and the most common answer is less than 1 in 11,000. Basically, they can't test any more specifically than that. But as far as each test has a different answer to that question. The likelihood of being wrong about the gender of the baby, they've never been wrong. In all the samples that they've run, not one time have they been wrong. So 100%. As far as the most common things we used to be able to test for, trisomy 21, 18, 13, the likelihood of being wrong is less than, it's greater than 99% sensitive and specific for these problems, so it's really great. The only exception to that is the monosomy X. It's 90% sensitive and specific. So they're able to miss a small percentage, but no other test can give even close to that. And they'll only get better as these tests continue to advance. So that's the one exception.
And I think that's an important point in these tests, especially the Myriad, is that they collect all of the genetic material de-identified, and so they are building a library that is.
Yeah. So it's not, your information isn't attached to that. That's an important part of that, right? But they're looking at, based on your family history, if you had a really strong family history and you tested negative for all these cancers, they can use that DNA to find out that cancer, and then they'll have update tests. And then they'll offer update tests when they become available to say, you know, you would have met criteria for this newer test, maybe you should have this test done. And then they can offer you that update. Instead of having to do all the other tests again, you can do just the updated tests. Because they're finding families like yours that have this specific gene, and maybe you have that gene too. But they won't store your blood, run the update, and then call you and tell you it's later on. You'll have to redo the test. But they'll use it for research. They don't have that identified to you, so they won't know for sure that it was your blood that tested positive or negative, so they won't be able to give you those results in the future. But anyway, yeah, so $25 for the panorama. Any other questions? It was nice meeting with you ladies today. If anybody's looking for our office, we're on the first floor, back in the corner, by Dr. Crone's office for the pediatrics. Northern New Mexico Women's Health Center, and we've got openings every week.